I don't need an introduction, but for the sake of the
Absolutely.
viewing.
I forgot how much I don't like these chairs.
You're used to those expensive ones on the 911 center.
Sync. Good morning. My name is Bob Dowd. I am the Director of the Department of Emergency Services. I'm here today because Commissioner Litz requested that I come up and kind of give a summary of the vaccination site and efforts in Lebanon County. So that's what I'm going to do. The Lebanon County Community Vaccination Center opened on March 17th with very little notice, but March 17th in partnership with CNS Occupational Medicine with the first day that it was open seeing approximately 1,000 appointments. From that point on, the vaccination site was open for a minimum of 3 days a week all the way through till its closing. On April 1st, Wellspan began their vaccination operations at the site as well, bringing additional days of operation to the center. Wellspan mainly operated during the weekend. They were a partner at the site all the way through May 9th. And then the center was officially closed on May 27th. That was the final day of operation. That day was all second doses. When we first set out to turn on this site, the plan developed with vaccine providers was that this site would probably run for 6 months or more, for possibly 7 days a week, but a minimum of 5 days a week to meet the projected demand that was going to be there for vaccines. That was not what the reality turned out to be. We followed the state's vaccination plan, which defined eligibility and timelines. And with the opening of each new phase, we expected large waves of those newly eligible people to start registering for appointments. Fortunately, phase 1B, 1C, and then phase 2 brought underwhelming demand. I think there were several factors that led to the underwhelming demand. Probably the biggest being that phase 1A expanded on a regular basis. Every week that plan from the Department of Health changed and brought in additional people into phase 1A. And I think that a lot of the people that would have been in those other phases were just able to get in earlier than what they thought. Another factor was an increase in vaccine supply and vaccine providers, which very quickly crossed as the demand went down, the supply was going up, and the vaccine providers and locations were going up as well, just making a large-scale site like that less necessary. Now, regardless, this site had a profound effect and filled a very big need in Lebanon County. Approximately 33,000 doses were administered at the location. Several things worth noting about the site, just in general. It was one of the first sites to open in the state. I know Lancaster had opened the previous week. I'm not sure about Philadelphia and Pittsburgh. I know they had opened a little bit earlier than us. I'm not sure about the timeline now. But other than that, we were very early to this, and that was a good thing. During the time the site was open, there were 2 vaccine providers running it for a good chunk of it, and that gave us 2 different vaccines there. We had both Moderna and Pfizer. That gave people a choice. A lot of people wanted a specific vaccine. Welsh Mountain, which is now Union Health, who had been a key partner with us long before the vaccine site had opened, was also planning on coming in and being a part of the site. However, their vaccine supply only became available as the demand plummeted, and it never came to fruition. It's also important to recognize the fantastic partnership that we had with Union Health prior to the vaccine site being turned on. We worked with them starting in January to get through phase 1A essential workers, so your healthcare workers, people that weren't affiliated with health systems but were still eligible in 1A. We also worked with them and Lebanon Transit to send buses to some of the high-density, age-restricted communities and get those people to the vaccine location at Welsh Mountain's facility to get vaccinated. They were great to work with. I also want to recognize CNS Occupational Medicine, who's kind of an unheard of entity to us until this vaccine site came around. We couldn't have asked for a better partner. They were absolutely fantastic. They were the first one up and running, and they brought with them a ton of capacity. Right out of the gate, they were able to handle 1,000 people a day, and by the 4-week mark, they were ready to handle 2,000 people a day, which is huge. They were just great to work with. They constantly asked us what they needed to do to better suit Lebanon County and better serve our needs, and they were light on their feet and able to make it happen whenever we had a request. you know, we had a ton of great partners at this site, and that's what made it a success. The lease was automatically terminated at the end of June, and it's no secret, about 15 minutes after that lease was terminated, it was bought by Target. So I'm pretty sure that the current owners wanted us out of there. The timing worked out well. We didn't have to exercise an option to renew.
You cleaned it up for them a little bit.
It was clean when we got there, I'll tell you what. The building, there was not a trace of Kmart in there. It was amazing. You couldn't find a label. It just, they did a great job.
Not that you were looking for one.
No souvenirs.
Yeah, nothing. So yeah, Target's coming. We're all pretty excited about that. At this point, vaccines are readily available. You can go to vaccines.gov, that is plural, vaccines.gov, and you can search by brand, location, availability. It's out there. If you are looking for a vaccination at this point, you can get it pretty much anywhere. I also want to recognize the monumental effort that my entire team put out to make this happen. This was a real short timeline with a real big lift, and they made it happen, and they made it happen you know, to the highest standards. I can't thank them enough, and specifically the emergency management team, led by Deputy Director Joe Morales and planning officers Briana La Liberty and Jason Weikel. You know, they spent every day there, including weekends, long extended days, just to make sure that this site operated continuously without a hitch the entire time. We also had assistance from a ton of volunteers, and all of them deserve a huge thank you for the time they committed to making this happen. So to wrap this up, I can just give you a couple of statistics as far as where Lebanon County is, the state, the nation, the world. At this point, Lebanon County, this number's as of Friday, by the way, is at 45.3% fully vaccinated. The state is at 50.9%. Nationally, the average, or the current vaccination, fully vaccinated, is 48.5%, and worldwide, for anybody that's interested, is 12.1%. So, the nation's doing well.
What was the nation? I'm sorry.
48.5%.
There was some newscast, since that was Friday, I think it's been since then, that the state's at like 61% fully vaccinated, so it went up a little bit over the weekend, maybe.
Quite possibly, yeah. And those, they do data dumps.
Yeah, yeah.
Mr. Williams had a comment.
Well, I'm sure all of us feel the same way, but Bob, you and your team, and I know the sheriff was involved. I don't think in Lebanon County we have to take a backseat to anyone as to how we handled this pandemic. Yes, Lancaster had their site open, but they didn't have any vaccine, so that was kind of a joke to begin with. So congratulations to you, and you're recognized in the community as a leader all the time, but especially a leader during these times, and we certainly appreciate your efforts, and I don't think we could have done any better, so thank you.
Thank you, I appreciate that.
The lives that were saved because of your efforts are uncounted, but we know it happened. Without the vaccine and bringing in the group, I think they were from Lancaster County, weren't they?
Yes.
And then Wellspan, and Stephanie Andriazzi was fantastic with information. They just communicated so well and worked together like a well-oiled machine. I stopped in numerous times. I saw First Aid and Safety Patrol in addition to sheriff's deputies there. I mean, we had the security, we had Lebanon Transit stopping out front to give people rides back and forth. What else could you ask for? And people were so grateful because there was a lot of stress. Am I going to get the virus before I get the shot? And that was on everyone's mind. Well, maybe not everyone's, but the majority of people's minds, in my opinion. So here we are looking at 0 to maybe 3 cases a day, new cases a day, for a week. And that means, in my mind, the coronavirus is on the way out, unless the variant kicks up. But, you know, keep getting those vaccines, people. If you're not vaccinated yet, you know, honor these fellas that put and lady that put in all the time to get the vast majority vaccinated so that you can feel a little bit safer, but you're only going to be totally safe if you too get the vaccine.
It was absolutely a community effort, and there's lots of vaccine providers that were working in parallel with us outside of our facility to make this happen. So
Yes.
Wellspan had their vaccination site open at the hospital for a long time before this site was up. And
Dr. Nazari was open, taking people in, and then of course it went to the pharmacies and the grocery stores, and it was just like, wow, we were on it, but now we got to get the percentage up.
that's why we're able to sit here today.
I just want to add, to my colleagues have covered a good part of it, and when we hired you for this position, no one could have foreseen what challenges would be ahead of you, and we are so grateful that you are in this leadership position for Lebanon County. Because in addition, there's a lot of bigger things, the 911 center, that are running parallel, and you've been able to keep a lid on everything and keep it moving forward, and it's an exceptional job that you've done on behalf of the entire county. Everything that you do impacts everyone. They don't realize it until there's a pandemic or there's a large storm or fire, but your folks are there 24/7 to respond. So it's a huge responsibility that you have, and we appreciate that you're the one that's in it.
I really appreciate that, but I am absolutely nothing without a good team.
Well, you developed that team too, so you're not going to escape the responsibility for our comments.
Thank you.
Anything else?
I just wanted to say, just in light of the barn fire yesterday, and then the Brandywine CSR fire, I mean, in the newsroom, we have a monitor to the 911 dispatch. The telecommunicators are extraordinary.
Yes, I know.
And you can really hear their professionalism when they are dealing with all this stuff going on, and the fire chief's on the scene, they're barking out orders, and it's really an amazing process.
They're an incredible group. You almost have to be wired differently to be able to manage that many things happening at the same time. And we have a fantastic group. They're good at what they do. I appreciate the compliment.
The only other thing, sorry, keep this going. Is there an award here somewhere? But the other part that was so important at every turn was the coordination between the commissioners, the president judge, all the sheriff, all the players that had a piece of this thing, and you were at the epicenter of it, moving it along and getting it through every new phase that we were faced with. So that's another piece of it that the public doesn't see, but it was internally huge. So anyway, that's it.
Thank you.
Jamie.
I have some comments similar to what Commissioner Ames had, but I'm going to segue it into the 911 center if I could.
Sure.
So, because it's sort of not on the agenda, but I wanted to give a little quick update on where we're headed there. But one of the things, since Bill brought up Lancaster County, I wasn't going to single them out, but
And they got their money ahead of everybody.
right. So
We didn't get ours.
So Lancaster, I watched the Channel 8 News one night. Lancaster was setting up their vaccine center, and I think it was Bob's counterpart over in Lancaster that mentioned that they're going to spend, I forget what the 8-digit number was, but it was like $18 million or something like that they're going to spend on their vaccine center. I called him right away. I said, how in the world are they going to do that? Like, first of all, where's the money coming from and how? Neither of us knew. In contrast, we had an old Kmart, cleaned the floors, set up dividers, fixed the lights, hung wires for some Wi-Fi for everybody,
And you were in there doing it.
It was the most. I was just trying to be the best forklift driver I guess I could do.
Everybody helped. It was awesome.
And we had the most practical, functional center, but it didn't have new carpet. It didn't have sound system from corner to corner or whatever else they did in some of the other places, and that is not only reflective of Bob but also the area. People don't
Lebanon,
want.
Believe in frugality.
Right,
Lebanon
and it was
County
functional,
is-
and I don't know, these are all reimbursable costs, but I don't know if ultimately the price tag on it, but it was probably 5 or 6 digits, not 7, in the low, you know?
We're still waiting on a whole bunch of invoices.
I mean, you bought dividers, you bought technology,
Probably $200,000, maybe 250. You know, just nowhere, yeah.
and it all, you know, had to get set up really quickly, and if you divide that by the number of people that were served, I'll bet you our number is per head a lot lower than some other places. So I think that was very well done, and yeah, I mean, it was just very practical, and we had plenty of room left. We could have had more providers. The lease was
Ten
reasonable. I
providers in
mean,
there.
We were ready
Yeah.
for them, and that was the original plan. Anybody who wants to come, this is an open invite.
Yeah.
But
I wanted to segue that to the 911 center because that is going to be a lot of money. And it's probably going to be the biggest project, and I'm anticipating that, you know, we're gonna have people, when that becomes more known and the numbers become more known, it's gonna sound like, wow, we're building something extravagant and unneeded, but that, in my opinion, is not the case. The costs are gonna approach $40 million for this facility, and we talked about that a little bit before. That's for the facility itself.
which, you know, despite, you know, continuing to refine this, those original costs we presented haven't gone up.
They haven't, and I talked to our construction manager yesterday, most recently, and he is sticking to those numbers. There was contingency built in. He feels confident. You know, I'll have my fingers crossed on bid opening day, but in speaking with Ned, by the way, and this is while we're praising Bob Dowd, I guess, today, I'll continue that. But,
Ned Pelger, if you want to just...
Pardon me? Ned Pelger, right, who's a construction management on the job. He has fielded comments, and he believes himself that working with Bob and his staff has been a very good experience so far, and what they often come across is a building like this is a monument to someone, you know, or but this is, again, being done practically. I mean, I don't think we're going to have something that is extravagant. It's going to be functional, but the type of construction is very expensive. It is similar to hospital and correctional facility instruction. It's hardened. There is a lot of technology, and I think the most expensive part is a lot of redundancy. Things are 2 and 3 times redundant in some of the operations and the HVAC and so on in the building. So that's what really drives the cost. At this point, design is finishing up, I think. They're down to some minutia from what I can tell from the meetings. Ned said yesterday he is still targeting mid-September for bids. I spoke with Jay Wenger of Susquehanna Group, who we lean on for some financial consulting, and he's recommending that in the end of August we do the ordinance that'll set the stage for financing for it. Of course, we won't know what the financing will be until we have bids and we have numbers and so on, but we at least start to set the stage or set the table for that. And you know, we will see. Fingers crossed. I hope numbers hold out. Supply or material costs are starting to ease a bit. Mm-hmm. Supply chain is still a problem. Steel is a problem. You know, steel structure is months out in advance. So that's kind of an update on 911
It would be
center,
nice if the
emergency
federal
services.
government would allow us to use that money for the 911 center.
Yeah, that's
That would be
something
nice.
that the three of you have all, you know, hoped
Lobbied
for. Don't know whether that'll pan out or not, but the American Rescue Act money does not appear to be easily usable for a bricks and mortar facility, even an emergency facility like this that has a role in a pandemic. It's just been something that's, you know, kind of been excluded.
Although somehow school districts are
Yeah.
allowed to use their, you know,
For building, yeah.
how is that possible?
Or if we were doing a sewer system, we could use it.
This is for the entire county's safety, and
And
it's
that,
hard to believe.
you know, if we could do that, it would be a windfall, because of course we started designing this, you know, before the pandemic came along. So
Correct.
if we were to be able to use some of the $27 million that's being allocated, that would be a windfall, and it would be good for the taxpayers and everyone. We wouldn't have to borrow as much, but right now it's been a struggle to try to make that case.
But there are components that possibly can be
Possibly.
funded. So we have to keep on our toes, and I know Bob is on top of it. Just trying to figure out how we can follow the rules and still benefit the citizens of this county with that 911 center when it comes to the American Recovery Plan.
Just want to add, the sticker shock of 40 million on a project that the county's involved in is rare, if ever, this size for a 50-year projected building that we're doing out there. But school districts routinely are spending $40 million on renovating. Even Lebanon High right up the street was $38 million, I think, for that renovation.
And 10 years.
And that's
they
for
want another,
1,000
yeah.
students. This is for 140,000 residents. I mean, it's so, keeping it in that context, it really, for per capita, it's a great deal.
Rest assured that from the design professional's perspective, what's being designed, what's being needed is, I believe, reasonable. And they're pointing that out. I mean, Ned talks about that, and I think Dave Schrader, all the people involved with this. We have a subject matter expert, which is an architect or a firm that does specifically this kind of facility across the country, and I think on the West Coast they were seeing $550 per square foot cost for this kind of facility. I don't think we're going to be quite there, but we're going to be, probably in the, well, I don't want to guess. We'll see.
Well, then, construction is, in general, just more expensive than what it used to be. And this is a hardened building it needs to be functional, it needs to be durable, and it needs to last for 50 years without us touching the footprint again. And I think we'll be able to achieve that.
What I like to tell people that I want to discuss it is this needs to be the last building standing in Lebanon County and operating.
Yeah,
It
that's
really
true.
does. If there's some sort of,
It's absolutely critical to the continued operation of public safety in Lebanon County. It's the central point, so.
Good update.
Okay.
Anything else? Okay. Thank you, Robert.
Thank you.
I just want to say that everything that we said here this morning makes me proud to be a resident of Lebanon County, but especially proud to be able to serve as a county commissioner. It takes a lot of good people to make good things happen.
I appreciate having the support of your excellent board, and we're accomplishing good things. Thank you.
Thank you, Bob.
All right.